Very good evening to all. Welcome to day 4 of Faculty Development Program on Science of Rehabilitation organized by Department of Physical Education or University and Spinex Global. Yesterday, Dr. Jatin Maheshwari has taken wonderful session on applied exercise physiology during hot and cold environment and other related aspects. And I must say that his knowledge for the subject and way of explanation was incredible. Today he'll be continuing guiding us on exercise physiology on a high altitude acclimatization. Now, not taking much time, I would like to invite a very young and intelligent subject expert of the day, Dr. Jatin Maheshwari, to start his presentation. Dr. Jatin, over to you.
Hi, good evening, ma'am. Good evening to all the viewers. Once again, thanks a lot for this platform to deliver my knowledge about this topic. So, today I'll be taking the exercise physiology for the high altitude. Okay. So once again, very good evening to all the viewers. So yesterday, I took the topic about the exercise physiology for exercise on hot environment, cold environment. Okay. So today I'll be taking the third component of that exercise at high altitude. Okay, what are the changes in our body at the high altitude, how the exercise is going to happen at high altitude, how the body is going to adapt, that is acclimatization at high altitude. Okay, and how we can overcome that. What are the consequences and the medical problem that a person can face at the high altitude. Okay, so let's get started. So today we'll be covering up the high altitude. What is high altitude? Okay, what are the stress that come at high altitude? Okay, the oxygen loading. Okay, what are the components which is going to invade the oxygen loading or oxygen function or oxygen consumption at high altitude? The acclimatization, the adaptation, the physiological and the metabolic adaptation of our body at high altitude. Okay, which consists of immediate changes and a long-term adjustment in our body. Okay, then we'll do the high altitude medical problems. I think 3 or 4 problems I have included in that. And after that, uh, the exercise component at high altitude, how it is going to affect the aerobic capacity of the body to do the exercise and the anaerobic also. So we'll be discussing all these things. Okay. So now, so am I visual? Am I my video is on or am I audible properly? Check. Okay, it's perfectly clear. So now proceeding further. Uh, so what is high altitude? So basically, the word are resembling its meaning. The height and altitude, like height above 10,000 feet, that is 3,000 meter above the sea level, is defined as high altitude. Okay, the ground surface on which you are, that is the sea level, and above that it comes under like about 10,000 feet. That is high altitude. Okay, then what happened for the gases? The main problem that the person face or the physiological changes that hamper the physiological system of our body is the gaseous pressure, which is changing. Like Say for example, the pressure of the water and CO2 doesn't depend that much on the altitude, but the oxygen pressure, like the ambient pressure of oxygen, the saturation of oxygen, the pressure of inspired oxygen, okay, and the pressure of nitrogen gas decreases when you incline, when you ascend, okay, when you go towards the high altitude. These gases, oxygen, nitrogen, goes down. In oxygen, three components are there. The ambient pressure of oxygen means environmental oxygen pressure. The body saturation oxygen saturation of our body, that is then after that the nitrogen pressure, and one more pressure of oxygen, that is pressure of ambient oxygen that we are inspiring, that is also going to down when you ascend. Okay, now at high altitude, a low partial pressure of O2 can leads to hypoxia, that is the lack of oxygen in the blood. Okay, then look, when the altitude level increases, it leads to decrease in the ambient pressure and ambient like we can say atmospheric pressure also going down. The we can say the baric pressure, it's going down, the oxygen saturation going down, the oxygen pressure going down. It leads to hypoxia. If I would want to explain it in a brief, as you can see in this graph, first of all I want to mention, like, this is the atmospheric, like barometric pressure line, okay, and this is the height of the altitude. Okay, this is 0, this is 5 into 1000, 5000, 10,000, 15,000, 20,000, 25,000, and 30,000. Okay, then these are the values in the feet, and these are in the meter. Okay, into 1000, 9,000, 7,000, 5,000. Now look at this, you got this line, you got this line. Okay, now see first this saturation of oxygen. This is the height, you can see this is the saturation line, the orange one. Okay, and this is the saturation from 25 to 100. So when the height is increasing, you can see there is decline in the saturation. Okay, decline in the saturation when you are ascending up, and up to a point, like if you can say it is descending down from somewhat here around 10,000 feet, it is descending from 90. Okay, it is going further low. As you are going up, you can see the cursor, as you're going up, the saturation, the orange line, is going towards the 50, and further you will go up, it will further go down. Okay, now another, this, if you can see this yellow line, this is the partial pressure, the ambient pressure of oxygen. Okay, like the oxygen pressure in the environment, in the atmosphere. Okay, so this is the scale of this line, and same, we'll gonna see the height, like we are ascending. So if you can see, whenever you are going up, it is also going down. It started from 100, and if you are proceeding up, up, it is went around 35 to 40, and if you go proceeding further, it will also go down. Okay, in the same way, if you can see this purple line, okay, this is of atmospheric pressure of carbon dioxide. So whenever it started from 40, when you go up, ascend to the altitude, it goes further towards the 20 or 10, and further you go up, it further declines. Okay, so, and this red line is also the important one. This indicates the oxygen that you inspire from your atmosphere. Okay, so when you go up, when you go up, it further declines, if you can see. Okay, so main thing is nothing of the pressure of the gas is going to increase, they are going down and down when you go up. Okay, for further, you can check here, you can check here, like this is the meter altitude measurement, this is the feet. Okay, the SI unit, this is in meter, this is in feet, and this is the barometric pressure of the atmosphere, and this is for the oxygen pressure in the atmosphere. Okay, so if you can see, when the ascending, you are going up and up and up, the atmospheric pressure is also going down, and same with the oxygen pressure in the environment is going down, resulting in, you go up, resulting in hypoxia. Okay, the lack of oxygen in the blood. Fine. And after these measurements, we can see these are the name of the Everest, the peaks, okay, and the topmost is the Mount Everest. Okay, now if you can see, this is the point A. If you are at 5,000 feet height, you gonna get a lightedness or a mild headache. Okay, if you go further up, like this is the B point, the 10,000 feet, the barometric pressure falls down to 523. You're gonna get insomnia, a nausea, a vomiting, a pulmonary discomfort. You will feel some breathlessness. Okay, when you proceed up more, you will ascend more. This is the point C. It's somewhat around 14,000 feet. So you're gonna feel a dyspnea, a severe dyspnea, I would say, an anoxia, a gastric disturbance. Okay, there is a decrease in the motility of the intestine, of the peristaltic movements got get slow. Okay, then after that, when you proceed further at the point D, like around 20,000 feet, you feel a general weakness in your body, lethargy, I would say, very much difficulty in breathing. Okay, and various psychological problems you'll also face, the lack of a proper decision making, a lack of proper concentration on that thing, that like whatever you are doing. Okay, and the last point is E. When you're proceeding more up, the barometric pressure is 282 and height is 25,000 feet. And here, as you can see, the oxygen saturation in our body is also is around 50, very much low. The inspired pressure of oxygen is also very much low. The oxygen in the environment is also low. The carbon dioxide pressure is also low. So in this thing, you're gonna collapse. That collapse, the unconsciousness, and even death can occur. Okay, so that's this is the brief idea ki what are the impact of the high altitude on the gases and your body. Just a brief one. Okay, now if we go in a detail, like different systems of our body, what are the effect of hypoxia that is occurring if you are ascending to the high altitude. Okay, in that, first just take a on blood, what will be the effect on the blood system. Okay, there will be increased RBC count. Okay, which means there will be the you can say in the amount of thickness of the blood increases. Okay, RBC count increases. Okay, viscosity of the blood increases. Okay, increased secretion of erythropoietin. Okay, just to make more RBCs. Okay, then if we talk about on the cardiovascular system, there will be increased heart rate. Force of contraction of the heart increases to propel the blood into the various part of the body. Okay, cardiac output will also increase. The force of contraction of the heart is increasing, then obviously the blood pressure is also going to increase. Okay, now if we talk about on respiration, there will be, like if you are going up and the body is starving, urging to take the proper breathing, and definitely the body gonna respond in increasing the pulmonary ventilation, just to order to normalize the ventilation of our body that is going down due to the high altitude. Okay, and this is the phenomena that I'll be telling you later, okay, why there is increase in the pulmonary ventilation, what is the physiology behind that. Okay, on digestive system, there the loss of appetite, the feeling of nausea and vomiting will be there. Okay, if I talk about on kidney, their alkaline urine due to increased erythropoietin secretion. This is the thing I also want to mention you guys in the upcoming slides. What is the physiology behind like the urine gets alkaline. Okay, this is also related to that respiratory system. Okay, and what will be the effect on our central nervous system, the mental state of our mind, the psychological state of the mind. Okay, there will be the depression, apathy, the general loss of self control. Okay, you're talkative, you'll feel some aggressiveness that can be quarrelsome. Okay, a little bit irritated, frustrated, rude. Okay, you are not that much oriented. Okay, the judgment power will also hamper a lot. Okay, the memory impairment. These are the things when you go a little up on the high altitude, like when the saturation is just below the 70. Okay, oxygen saturation, I would say. And in acute case, there is severe hypoxia, and there may be the sudden loss of consciousness, and death can happen. Okay, then effect of expansion of gases. Okay, like their expansion of gases is also occurring on the high altitude. Like, so what is happening in the gastrointestinal? Okay, so in GIT, the painful distension of the stomach and intestine. Okay, because of the decreased pressure of the atmospheric gases. Okay, in lungs there will be the expansion of gases that may destroy alveoli. As longer you go up, there will be the pressure due to the decreased pressure, or the hyperventilation phenomena of physiology of your body can hamper the alveoli of the lungs. Okay, and rapid ascent, if you go rapidly up, it decompresses your sickness. Okay, what is rapid ascent? If you have traveled in the flight, you will observe that you have observed that the flight, like the flight has up, it goes slightly up, then after some time, then go up, then after some time, then go up. It never goes directly ascent. It never ascends directly. Okay, to avoid the complication of a rapid ascending, the flight goes slightly up, then up, then up. The slowly ascending is here to avoid these impact on the body. Okay, okay. What is the effect of fall in atmospheric temperature? It's very much obvious. If you are going ascending on the peak, okay, there definitely fall in the temperature. Okay, and the same impact and the same effects on the body that we have learned yesterday, like exercising in cold temperature. Okay, the same physiological changes is going to happen on the body if you're going up. So that's just, there is a fact that when you ascend 1000 feet, the 2 degree of temperature falls. Okay, every 1000 feet increase, there will be decrease in the 2 degrees Celsius of temperature. So you're going up, 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 you're getting colder, colder, colder. And same with the things that will be happening due to the cold temperature, like cutaneous vasoconstriction, means the peripheral vasoconstriction will be there. Okay, just to maintain the core temperature. Okay, that we have learned yesterday. Then prolonged and severe vasoconstriction sometimes leads to frostbite. Okay, because there is a saturation when the skin can only bear the cold temperature by just doing vasoconstriction, but prolonged vasoconstriction may cause the frostbite. Okay, now oxygen loading at altitude. How the oxygen loading is going to hamper on altitude? Okay, uh, like suppose when you ascend, the alveolar pressure of oxygen decreases. Okay, like if your partial pressure is 100 mmHg at sea level, but when you go up, 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 sometimes it decreases, and the changes in the body started coming from, like, if I would say 80, 78 mmHg or 80 mmHg, the symptoms starts coming. Okay, and if you see, if you're going to the mild altitude is not that much of problem, but if you're going to moderate level and even the severe level of elevation, high level of elevation, your saturation, oxygen saturation of your body drops down too rapidly. Okay, and can negatively impact your body, can negatively impact your aerobic capacity. Okay, you won't be able to do something at that time. Okay, now, if I talk about a person who is already adapted to high altitude, like you can say an acclimatized person, if the person is going above 17,000 feet, okay, where you can say a permanent living is not that much possible. But if the acclimatized person, like the mountaineers, who is going beyond or above the 17,000 feet, he can even survive with the oxygen aid. Okay, only with the oxygen aid he can survive. But when an unacclimatized person is going at that level of peak, even with the oxygen aid, he would get unconscious in 30 seconds. Okay, so this is the difference between the acclimatized and the unacclimatized person. If I talk about the altitude of even 17,000 feet, okay, like I have already explained what is acclimatization. Acclimatization is the adaptation of the, we can say, the physiological and the metabolic adaptation of our body in response to the high altitude. That is known as high altitude acclimatization. Okay, so if I talk about how much time it will take to adapt the things at the peak level, okay, like if we are going around 2300 meter or around 7500 feet, it takes about 2 weeks to adapt that atmosphere. If you are following a proper exercise regime, then only you're gonna get acclimatized in the high altitude. Okay, and after that, if you are going further 2000 feet, it require around 7 to 10 days of time to get acclimatized further 2000 feet. Okay, again I'm telling you, if you are going around 7500 feet, you will require 2 weeks for acclimatization, and further 2000 feet it requires 7 to 10 days more. Okay, so this is the concept of how much time a body takes, but it can vary much because every body reacts in a different way. If I talk about the acclimatization, either it can be in the hot environment, either it can be the cold environment or the high altitude. Everybody responds in their own way. It can even take 7 days, it can even take 14 days also. Okay, and also depending upon the quality of exercise regime you are following. Okay, now in the acclimatization, there are the adjustments, the immediate adjustments, the we can say the long term adjustments are there. Okay, so I have few systems of our body that to understand the adjustment, what is the body is getting, the body is going on high altitude. Okay, so pulmonary acid base balance. Okay, this is the system, or we can say the pulmonary system. What is happening? Look, when the person is going on high altitude, there is decrease in the pressure of oxygen in the body. Okay, when there is decreased pressure of the oxygen, there are some mechanoreceptors in the arch of aorta, okay, and the branching of carotid artery. Those mechanoreceptors sense that, oh, the oxygen pressure is going down in the body. So what they do, they send the signal to the respiratory system of our body, okay, and increases the ventilation of our body. That is known as hyperventilation. In hyperventilation, what is happening? More oxygen intake is occurring. Okay, when you go up, lack of oxygen supply, mechanoreceptors in aortic arch and carotid branching activates the respiratory system and started the hyperventilation in our body. Okay, this is the one thing I want to explain. Now, look, when there is excess of oxygen intake in our body is happening, there will be decrease in the carbon dioxide pressure. Okay, due to which the blood become alkaline. Okay, due to which there is excretion of the alkaline in the urine. This is the reason I was telling you previously why the urine become alkaline. This is the reason to just balance the body. When the blood is getting alkaline, urine is just aspirating the alkalineness to in a we can say to maintain the pH. Okay, so this is the thing, the pulmonary acid balance, the hyperventilation, and the body fluid become more alkaline due to reduced CO2 because the excess of oxygen in the body is there. Okay, then the cardiovascular system. Like if you're going up, it's very much obvious the heart rate will going to increase. The when the pressure is, when you go up, there is increase in the blood pressure. Okay, for that there will be increase in the submaximal heart rate, increase in the force of contraction of the heart. Okay, increase in the submaximal cardiac output. But stroke volume remains the same because stroke volume doesn't increase that much earlier. Okay, and sometimes it gonna slightly lowers if the things won't go in a good direction. Okay, the stroke volume is the thing does not hamper easily. Okay, then maximum cardiac output remains the same or lowers slightly. Okay, if I talk about these things, just to try to understand, if you want to if you want to propel the blood into your peripheries in a cold or high altitude environment, it's very much obvious you'll be requiring a good force of contraction. Then only you can circulate the blood. Okay, that's why there is increase in the submaximal heart rate, submaximal cardiac output, and sometimes it gonna lowers the stroke volume. Okay, then there will be no effect on the hematologic or cellular level if I talk about the immediate adjustments. Okay, and comes to long-term adjustment. What are the long-term adjustments that is going to happen in our body? Okay, these are the things you can say, the acclimatization. If the half or more than half of the acclimatization has been done, these are the long-term adjustments. Okay, again, if we say the pulmonary acid-base balance will remain the same, the hyperventilation, there will be increase in the minute ventilation. The amount of inhalation and exhalation air in 1 minute is known as minute ventilation. It gonna increase. And again, the same like previously, it was more alkaline urination is there. So after few half or more than half acclimatization, the alkalineness of the urine or the blood slightly goes down because the body has adapted the things at high altitude. Okay, then the cardiovascular, same. The submaximal heart rate will remain elevated, same as it was happening in the immediate adjustment. Okay, but submaximal cardiac output falls. Okay, and stroke volume also gets lower. This is the adjustment. Okay, initially it was increasing, but it has been adjusted now. Okay, and also the maximum cardiac output lowers, in that it was also increasing. Okay, then hematologic changes. In the hematologic changes, like I have already explained, like if you are going up, you'll be requiring more and more oxygen. You'll be requiring more and more RBC. You'll require more and more hemoglobin. That is why there is decrease in the plasma volume, because there is increased viscosity. Okay, there is increase in the hematostring. Okay, and there is increase in the hemoglobin concentration just to avail more and more oxygen. Okay, RBC's number are also going to increase. Okay, and if you are going up, so definitely your muscles gonna require more and more oxygen. Okay, so just to deliver more and more oxygen to your muscles, there will be increased capillarization of skeletal muscles, so that there will be a short passage to deliver more and more oxygen to the muscles. Okay, this is the thing. That's why there is increased capillarization of skeletal muscle. Okay, if I say about the local changes, there will be increase in the RBC cell production. There will be increase in the aerobic enzyme. Okay, the aerobic enzyme, there will be increase in the mitochondrial activity, because anyhow they are going to increase. Okay, or anyhow they are going to buck up the aerobic activity of our body that is requiring at high altitude. Okay, and in these adjustments there are nothing related to any anaerobic changes. Okay, it does not take any relevant changes at the high altitude, but aerobic changes have to be there. Aerobic changes occurs at high altitude. As you can see, increase in the aerobic enzyme activity, increase in the mitochondria, increase in the capillarization of the skeletal muscles. Okay, so these are the long-term adjustments. Okay, so various medical problems that a person can face at high altitude. Okay, so I have included the 3 to 4 medical problems. The first one is acute mountain sickness. Okay, when a person ascends quickly, when the person go quickly above the 10,000 feet. Okay, the symptom occur in 4 to 12 hours. It's just by mistake it has been typed 120. It's 12 hours. Okay, the symptom occurs in 4 to 12 hours. Okay, so what will be the symptoms if I talk about the acute mountain sickness? There will be loss of appetite, nausea, vomiting. Okay, the breathlessness there, and sometimes the pulmonary edema can happen. Not always, but sometimes it happens. Okay, there will be irritability, there will be lack of sleep, that is insomnia, you feel headache, depression, irritability. Okay, and sometimes there will be the edema in your cerebrum, that is known as cerebral edema, if it persists for long. Okay, not always, but longer persistence will lead to the cerebral edema. Okay, if the mountain sickness gets chronic, okay, it is known as Monge's disease. Okay, it is known as Monge's disease. It mostly occurs in those person who resides, who want to live permanently just beyond the 10,000 of feet of the altitude. Okay, it will produce the extreme polycythemia, pulmonary arterial pressure becomes elevated. Obviously, vasoconstriction, so pressure will gonna elevate. A right side of the heart become greatly enlarged. Okay, a peripheral arterial pressure begins to fall. Congestive heart failure can occur. Okay, and sometimes the death can also be there. The previous one was the acute mountain sickness, and if I talk about the treatment of acute mountain sickness, then the sudden, that to bring the person down to the sea level. Okay, or the sometimes the minimal of O2 supplementation. O2 supplementation can be given to the person, so the person can get normalized. Okay, then the another thing, another medical problem at the high altitude is high altitude pulmonary edema. Okay, this is the life-threatening condition in which there is fluid accumulation in the brain and also in the lungs. Okay, mainly in the lungs. Okay, but on the later stage, it can also involve the brain also. Okay, the symptoms may occur in we can say 1 to 4 days, that is 24 hours to 96 hours, if the person is rapidly ascending. Okay, and like if you are on the high altitude and you're doing heavy physical work, heavy activity, strenuous or intense workout in first ascending, like you are reached at the altitude, and if you're doing workout in initial 3 to 4 days, I would say intense workout, if you're doing for the initial 3 to 4 days, you're gonna get this high altitude pulmonary edema. Okay, what happened when you go up, there will be, and you're doing the intense workout at that time, there will be obviously increase in the sympathetic activity, which produces vasoconstriction. Okay, which normally increases the pulmonary capillary hydrostatic pressure. So when the capillary hydrostatic pressure increases, there will be we can see the dilation of the capillaries, and more fluid accumulates, resulting in edema in the lungs. Okay, the pulmonary edema. Okay, the treatment can we can given the just for us. I mean, it is the O2 therapy, or just bring back the person to the normalcy level. Okay, the you can say the O2 supplementation and urgent descending of that person to the sea level. Okay, the third medical problem is high altitude cerebral edema. Okay, previously was the pulmonary edema, and this is the I would say severe. Okay, neurological syndrome develops within hours or days. It occurs when the person reach above 9,000 feet. Okay, and what is the mechanism? The same mechanism that we are having previously, like if the pressure of oxygen is low, there obviously there is arterial dilation. Okay, which is regulated by cerebral hemisphere. Okay, so once this saturation has come, the cerebral circulation auto regulatory mechanism reach its limit. Okay, and therefore there will be increase in the capillary pressure, same what was happening in the pulmonary edema. There is increase in the hydrostatic pressure, the capillary dilation occurring, and more transmission of fluid is occurring, resulting in edema in the cerebral. Okay, and the symptoms are mostly same as the mountain sickness and the pulmonary edema, like headache, severe fatigue, nausea, vomiting, or the loss of consciousness can be there, a problem in decision making can be there. Okay, so a state of confusion can also be there. Okay, and what is the treatment? The same, like immediate descending from the high altitude and the O2 administration. Like the large dose of glucocorticoids is just a medical treatment, but just for our knowledge, we can just descend the person quickly down to the sea level and also administer the O2 supplements. Okay, the fourth one, medical problem, that is high altitude retinal hemorrhage. Okay, it is related to the macula of the eye. If you see that, like this is the eyeball, okay, this is your pupil. So just behind the pupil, there is a central spot, central pigmented area, that is a macula of the eye, which is mainly responsible for central vision. It got damage, it got hemorrhage. Okay, retinal bleeding occurs due to the excessive blood pressure, which causes the rupture of the blood vessels and mainly damage the macula of the eye, resulting in the vision loss, sight loss. Okay, eyesight loss. Okay, so the treatment is again the immediate descend the person down, O2 supplementation. Okay, and in all the four things, most of the mountaineers carry a portable hypobaric chamber. Okay, like hyperbaric chamber, like the pressure is low, they carry a portable mini hyperbaric chamber along with them, so that whenever they feel the symptoms like that, they're gonna use that portable hyperbaric chamber. I'll let you know in the end. So this is the main thing I want to mention, that is exercise at high altitude. Okay, so what is going to hamper when you're exercising at high altitude? That is your aerobic capacity. Okay, your aerobic capacity, that is your VO2 max, is inversely proportional to high altitude. Whenever you're going to up, your VO2 max value will go down. Like suppose your VO2 max capacity of doing workout at the sea level is 80%. But when you go at the high altitude, it will go down, down, down. It went around 30 to 40% also. Okay, like if you say even at the declination of the VO2 max value started from 589, or we can say 600-meter high altitude, the VO2 max value will go start declining. Okay, and also the VO2 max value will go down from 7 to 9% on every 100 meter of ascent, which means every 100-meter ups, your 10%, I would say 7 to 10% of VO2 max value will go down. Okay, second one, the exercise performance. Previously was your aerobic performance. Okay, aerobic capacity, this is the exercise performance. So it may be improved. Like there is a misconception in people that if we work harder at high altitude, we're gonna perform way better at the sea level, but this is not true. This is not there is no evidence of like that. If you're gonna practice at high altitude and you're gonna perform better at sea level. Okay, so like if you say there is one a research has been conducted which show a minimal small proportion of improvement in the performance if the person acclimatize himself for 30 days. So what are the changes that they have noticed? Was there was increase in the minute ventilation and comparatively from high to low altitude. Okay, increase in the arterial oxygen saturation, that was only 5 to 7%, not more than that. The slightly delay in the lactic acid response. Okay, which means there is slightly delay in the you can say the endurance of the person. But these all three things you can also achieve at sea level. If you're gonna work more on your aerobic capacity at sea level, you're gonna see these changes also at the sea level and even in 30 days. Okay, so nothing makes a difference of training at high altitude. Okay, it is equal. So exercise, I would say high altitude. If I want to clear a few things about the exercise at high level, exercise at sea level, this is the thing. Like I have already mentioned, the effect of acclimatized training at high altitude doesn't improve your sea level performance. It's equivocal. Okay, and I would say, like, if a person is at the high altitude for a prolonged duration, there will be reduce in the body mass. There will be 20% atrophy of the muscle and also decrease in the body fat. Okay, just because of requirement of the body more for the metabolism, the metabolic heat it's going to use at high altitude. That's why there is decrease in the atrophy of the muscle. There is decrease in the, I mean, there is a decrease in the muscle mass. Okay, 20% atrophy is going to happen, and also the body fat is going to come down by 20%. Then why it is occurring? Like first one I have already told, just for the metabolic heat, and also there is depressed of appetite, like no peristaltic movement as much, a decreased efficiency of is intestinal absorption. Okay, no absorption of the nutrients will be there, so nothing gonna happen on the body. It gonna lose its body mass. Okay, then if I say ki, 80% of VO2 max at sea level is equal to your 40% training of VO2 max at higher altitude, as I've already explained, ki, like if you are having 80% of VO2 max training capability at sea level, but at the high altitude, it's gonna get half, 40% only. Okay, so why I'm telling this? Because if a person who's already having a 40%, only 40% of VO2 max at sea level, so he should not go at the high altitude for the marathon, for the exercise purpose, for the training purpose. Okay, you have to train yourself around 80 to 90% of your VO2 max at the sea level, then you have to go up at the high altitude. Then the chances of getting a good acclimatization is there. Okay, like if you can see in this graph, this is the sea level. At the sea level, you're having a good oxygen consumption, that is VO2 max, that is 4. Okay, but you when you reach at the 4300-meter altitude, it comes down to around 2.8. So this is the thing I want to explain you, that when you at the sea level you are a good VO2 max oxygen consumption capacity, but when you go up on the altitude, your VO2 max or the oxygen consumption capacity goes down. Okay, now, this is the hyperbaric, I would say, chamber, which is known as Gamow bag. So, in this, the person will go inside this chamber, and you're gonna normalize the pressure around you, so that the symptoms that was coming from during the medical problems, it won't occur. Okay, so it is a portable chamber used to treat altitude sickness. Okay, it stimulates lower altitude in which a person can rest or sleep. It stimulates the descents altitude, and it would increase a lot the pressure that a person can feel that he is on the sea level. If you can see, this is the glass window, the person lying down, this is the head end, this is the leg end, and this is the pressure tube which the person is putting the pressure on, and this person is, it is not visible clearly, but this person is pushing the foot machine to fill the air in the chamber, and this is the medical doctor in the tree. Okay, so this is the, I think this is the treatment procedure. I have said that if you are unable to descend the person down suddenly, so you can use that portable hyperbaric chamber just to normalize the symptoms of the person. Okay, and the most of the mountaineers use that hyperbaric chamber. Okay, and that's all from today's. So we have done one chapter, I would say, which consists of exercise in heat, exercise in cold, exercise on high altitude. Okay, so this is it from my side, and I would like to hand over the screen to Janvi ma'am and Neeraj sir. So we can start the question round.
Thank you, Dr. Jatin. It was really very impressive and very informative session.
Thank you, ma'am.
And I'm a
Thank
lot
you so
from your
much, ma'am.
session, so I really very excited for more session in upcoming webinars and FDPs. And we look forward to have
Thank you.
your commitment for same.
Yeah.
Now,
Thank you so much, ma'am.
dear participants, you can write down. Yeah, welcome. Dear participants, you can write down your question in the chat box. Dr. Neeraj, over to you.
Thank you. It was wonderful, Dr. Jatin. It was very nice.
Thank you so much, sir.
Friends, you can write down the questions in the chat group. So there is a question. So does there any application it in clinical practice?
Yes, it is. It can be applied in the clinical practice when the physiotherapist with the army or the military people is going on the high altitude. So these are the things that they should keep in mind while treating them. How they are going to work on their VO2 max, that the person is if the person's capacity at the sea level of VO2 max is less, so they can suggest them that, like, while doing the rehabilitation exercise, they are not supposed to exert more and more, or we can say produce they can reduce their efforts while doing the rehabilitation exercise. And if it is required that the person have to produce more effort in doing rehabilitative exercises, then they can use the oxygen supplementation also at the high peak if the person is having low VO2 at sea level.
Is it vasoconstriction leads to nerve hemorrhage exercise at high altitude?
Look, at the high altitude, there is less conduction of the nerve also. It is related to the exercise physiology in nervous system that I will take later. But for now, I will tell you, like, if you are going at high altitude, there is more less pressure and there is less temperature also. There is, first thing is vasoconstriction is also there, which is also lead to decrease in the nerve conduction, and also the temperature is also less, so which is also lead to vasoconstriction of the nerve. uh, I would not say that the nerve hemorrhage is occurring, but I would say there can be grade 1 injury of the nerve, neuropraxia, and sometimes it can go further for the grade 2 and grade 3.
So O2 supplements like
O2 supplementation is the oxygen supply through the mask that we give to the patient normally. That is O2 supplementation.
so can we create a artificial high altitude at for the training?
Yes, like I was saying, like not in India, but for the outside the India, the army personnel who is going to be posted in the high altitude, at the sea level, there is artificial hypobaric chamber, I would say. So where they can train, they go inside, they do their regime, half an hour, 1 hour, and they come back, so that they can be acclimatized for the high altitude at the sea level. That is called you can say hypobaric chamber training for the, and even they can also apply it on the sports person also if he is going to play at the high altitude. Okay, if I talk about the skiing, okay, or the snow games, okay, so the people trains them at the sea level in these chambers, and so that they can perform well. As I've already mentioned, you need to get a good VO2 max percentage at sea level, because at the high altitude it got even half.
So why there is memory impairment on high altitude?
Due to hypoxia. If it is a normal thing, like if there is lack of oxygen in the blood, the brain would not function normally. That will leads to memory impairment. It happens at the like if it's a moderate to high altitude.
Sir, is there any precautions for migraine patients in case of altitude sickness or advice?
Yes, because sometimes the migraine headache, the migraine headache increases when there is increase in the temperature. So I would suggest the person to do the acclimatization training at the sea level in the hypobaric chambers. Then he can go up. Like he would train himself in artificial in the cold temperature also at the sea level and also in the hypobaric chamber. Then he can go further.
What does Gamow chamber comprise of such that the person is good at high altitudes, and how does it control?
Like it's having a thermostat pressure stats are there that can increase the pressure, which gives a sensation of lower altitude to the person. Nothing special in that chamber is there, but a channel which comprises of it can be implicate the O2 supplementation supply in that chamber also. And the symptoms are eye. The O2 supplementation can also be invaded with there is a loop in which the oxygen supplementation can be provided, and if the O2 supplementation is not required, the only the hyperbaric chamber can be used as the person. So there is a foot pump by which they can normalize the pressure by watching that dial over the Gambo chamber.
So, can you suggest a good evidence-based book on exercise physiology?
You can go with the like just for the basic one, you can go with the catch and catch, and for the advanced one, for the latest guidelines, you can go with the ACSM.
Can hemorrhage occur in the brain or other area of the due to vasoconstriction?
Like I have already explained initially, that much the the capillary dilation is occurring, which leads to transient fluid availability in the brain, which will itself leads to the damage to the brain. Okay, the pulmonary edema, that is what taking place, not the hemorrhage.
What could be the medicine for high altitude illness?
Like it depends what kind of high altitude illness the person is having. Like we have just seen about the glucocorticoid also, but for now, being a physiotherapist or being like a regular person, if I want to mention things for a safer side, that is the O2 supplementation or the hyperbaric chamber, and bring the person descends down quickly.
Friends, I can read certain comments about the yesterday's feedback form. Yesterday, it was posted in the chat also and in the box also. And we have received more than 350 entries in the feedback form. So if you couldn't find it, you should again see and refresh the YouTube to find it. So can you throw some light on training athletes who have cardiac issues?
Okay, yeah, I would definitely throw some light, but it again depends upon what kind of cardiac issue the person is having. Okay, either the person have gone through with the cardiac surgery or not. Okay, just for a brief, you should take a thorough about what the cardiac issue the person is having. Okay, then you can train the person along with the, like say for example, if the person is having say for example atherosclerosis, so you can go with the prudent diet and along with the minimal training as depending upon it the person's VO2 max. I would suggest just to go with the minimal training of that person, depending upon the reports of the person how much the blockage is there, and then you can go ahead.
Sunil is asking that can you suggest any special nutrition diet for high altitude sportsmen?
For high altitude sports person, like we have already gone through that, there is less response of the gastric. Okay, so you can take the light diet. Okay, you can take the simple carbohydrates. Do not take the complex one, as the gastric system is also already depressing and not that much of intestinal absorption is taking place. So you can take the simple carbohydrates. And also the hydration, can you can also take the hydration, because if the person is at the height, the cold is there, I've already explained previously, there is dehydration can be there due to the respiration. So you can also keep in track of the fluid.
Yeah, sir. Same question regarding the fluid by Swati.
Okay. Okay, the same question I would say ki, like if you are going on the high altitude, there is less temperature. Then again, the inhalation of the air, it's cool. It's not moisten. So when it enters in, our body fluid make it moisten. Then allow it to go into the trachea. So we'll be doing the fluid loss in that way. And again, when we are expiring, the fumes are coming, so that is the tiny water droplets which is discarding from our body. So again the fluid loss is coming, so you have to overcome your fluid loss in the same way the guideline that I have given previously. And again, you can also follow the weight loss formula, as simple as that.
So high altitude training VO2 max. This much they have written.
Okay, like VO2 max percentage is what is the oxygen consumption at the strenuous activity you are doing. Okay, for VO2 max calculation, you can use the 12 minute walk test. Okay, 12-minute front test you can do. After that, you got to know your capability of VO2 max, and you can train yourself at sea level at good, I think 80 to 90%. Then you can go up, because it's gonna almost up.
Kesha is asking, there are people who experience hearing problem at high altitude. What is the mechanism behind this?
Okay, this is the related to the ischion tube of your ear. Okay, like I know what, like if you ascend up, like if you're in a flight, yeah, the ear get blocked. This is due to the maintenance of the pressure of the ischion tube of the ear.
Does acclimatization time different at high altitude for different sports?
Acclimatization time is not dependent upon the type of sports, but it is depending upon a person's body and the physiologic system. Okay, first you have to acclimatize yourself, then separately you have to work on the sport.
Dr. Binasha is asking, during high altitude trackers are advised to drink water continuously to combat high altitude illness. Please explain mechanisms.
The same thing I want to explain, like if we are going on high altitude, if we are going on in the cold temperature, the already the pressure, okay, the things are coming, the stress is coming on the physiological system. And third mechanism, if the dehydration will gonna add, the situation will gonna worse. Just to avoid the dehydration part, like like I am telling you, if you are going up, your blood pressure is going up. Why the blood pressure is going up? Like, because whenever there is decrease in the blood volume of the body, the blood pressure is going up. And even if you are going up, again the blood pressure is going up, just to maintain the volume of the body, fluid volume of the body, and to avoid the dehydration, so that the little physiological function can work normally. That's why it is recommended. And there is fluid loss. It's not like that key person is gonna dehydrate in the hot weather also, but in the cold the person is also getting dehydration. That's to avoid the consequences. It is recommended for to take the fluids.
If a patient have mountain sickness and COPD, what is the procedure of exercise in high altitude?
Again, I am telling you, first train the person at sea level. then you can proceed further at high altitude. If you have seen, like the people have know, like if the person is going on Amarnath Yatra, the person should not be of COPD. Why? Just because the situation can get worse at the high altitude. That's why it is not recommended for the COPD person to go at high altitude.
How long does a person can sustain at high altitude without any medical dysfunctions?
It depends on the level of high altitude. I would say ki above 10,000, the person will get the medical dysfunctions even after 24 hours, and obviously gonna get it between 48 to 72 hours.
Climbing down burns more calories than climbing up mountain. Why?
Climbing down burns more calories than climbing up mountains. It depends ki what amount of high altitude you are going up. Okay, if you are not going that level that your body metabolism is comes into play, then you are not going to lose the weight. As I've already explained, if you are going up, there is there is demand of the metabolic heat. Okay, you're going to lose the 20% of body mass, that is includes the atrophy of the muscle and the body percent. But in this, if you have not mentioned the height of the altitude, but climbing down burns more calorie is the intensity of the exercise varies. Going up is less intensity of the workout is here, but going down is more intensity of the work. So I think this is the mechanism for that. The burns more calories while going down. More work is going to happen like.
Yeah, so before we take further questions, I would like to inform our viewers about the tomorrow's lecture. Uh, shall I, sir?
Yeah, definitely, sir. Please go ahead.
Friends, we are having tomorrow a wonderful speaker from USA. He's into research for last 22 years, and he is a wonderful physiotherapist, Dr. Saurabh Mehta. He's going to teach us about the fragility. It's a wonderful concept for the elderly people and physiotherapy. So please join, and please ask your friends also to join tomorrow's webinar. It's going to be very, very informative for all of us. Yeah. Sir, meanwhile, please let us know about the master class you are going to take for our viewers. Please give some highlight about that, sir.
Okay, in that master class, I'll be that like this is the only one chapter I took, like exercise in heat, cold, and high altitude. But in that module, I'll be taking that how the exercise physiology is going to work in muscle, in the musculoskeletal system. Okay, like the person, say for example, a person is having two kind of muscles, red muscle fibers and white muscle fibers. And in our body, there are different muscles who having a different proportion of red muscle fiber and white muscle fiber. So what kind of person required what kind of training physiologically, I will explain that. How the physiology is going to work on the bones if we are doing a weight bearing exercise or non weight bearing exercise. And then I will take the endocrine system exercise physiology, how the exercise physiology is going to work on endocrine system, how the people are getting diabetic. Okay, people are getting PCOD. Okay, and what is the mechanism and how it can be corrected in, while just understanding behind the exercise physiology behind that. Okay, only the exercise is there that can cure these things. Okay, and how our body's blood system, we can say, there are some research like how the exercise physiology is going to increase the lymphocytes in our body, how the exercise physiology is going to work on the nervous system. Okay, how it can increase the motor unit output, how the exercise physiology is going to increase the activation of motor units. Okay, how it gonna hamper the pulmonary system. Okay, how it going to like in many patients, like there is less like if the, I would ask about the smokers, the lungs has already gone, how we can revive that with the exercise physiology, how we can train a cardiac patient. Okay, that is related to the cardiovascular system. Okay, and how it can also hamper the mental status of the person. So that's This is just a brief topic that I have explained, but many more topics are in those modules that I'll be taking.
So will it be helpful to people who are already in clinical practice or those who are students? How much it will be helpful to those populations?
Okay, it will definitely gonna help the people in the clinical practice. Like say for example, if the person is coming with the PCOD, okay, person is taking medications, but just for an example, the stress decreases the output of the hypothalamus. So how the exercise that we are providing to the person is gonna de-stress the hypothalamus, and then the hypothalamus automatically starts working normally. The PCOD will gonna cure. And in the same way, what is the like the diabetic patient is coming to you, okay? The osteoporotic patient is coming to you with like, so how you are going to implicate the different protocol from a normal individual, what are the precautions for that, and what is the reason behind that. Okay, like say for example, the cardiac patient is coming, how you are going to, the cardiac patient is coming and he is saying "Ki, I want to lose the weight." So how you are going to deal with that? Okay, what are the precautions we'll be taking? So these are the things that we can implicate in the clinical practice.
And sir, will it be helpful to the patients who are not having this kind of conditions also, and still they are coming for musculoskeletal or neurological disorders to physiotherapists? Can learning this exercise physiology in masterclass will be helpful to those populations as well?
Yes, sir, definitely it's gonna help. Like say for example, a person is coming with the low backache. Okay, like say for example, that person is having a much amount of we can say a white muscle fiber, and like the person is lacking the stability. So we need to implicate those exercises that can increase the red muscle fibers. That is the posture muscles. So once the stability will come, the person will not come again and again with that low back pain. Okay, so these are the things. Like the person is coming with a gout. Okay, like just leave the diseases. If a person comes just to decrease the weight, how you're going to decrease the weight of that person without causing any musculoskeletal or cardiovascular issues? So in that way the person can implicate in the clinical practice.
Wonderful, sir. I think learning this will definitely improvise each and everyone's perspective, and they will it
Yeah.
will precise the way they are working in their clinical environment. And this is going
Yeah,
to be a wonderful information to the viewers. Wonderful, sir. Thank you so much. So, shall we go for next question, sir?
yeah, definitely, sir.
So, what are the physiological effects of post altitude training?
Okay, the post altitude training, there are not that much of research that shows the effect of post altitude training, but as I have mentioned, three things. First one, there will be increase in the minute ventilation, there will be increase in the delivery of hemoglobin, there will be increase in the capillarization of the skeletal muscles, so that more oxygen can be delivered to the muscles. So these three things I would say.
So, will there be any change in performance from high altitude and low altitude?
Not that much have been seen, but these three things that I have mentioned, it is just related to the 3 miles marathon runners. That's all, and there is nothing changes in the performance if the person is training either on the high or low altitude.
What is the difference between the role of sports physiotherapist and exercise physiologist in term of high altitude training?
Look, a sports physiotherapist mainly related to the injury prevention and treatment of the injuries of that person, or to correct the biomechanics of the person. Whereas if the exercise physiologist comes into play, he would assess the cardiorespiratory status of the person, the capacity to maintain the normal physiology of the function, like to delay the fatigue. If there is the earlier the earlier accumulation of the lactic acid is coming, the fatigue is coming earlier. So how it can be cured? Okay, if the unit ventilation is not that much of that peak of the performance, then how it can be gets better? So he can assess and design a protocol for the person just to correct his physiology, whereas a sports physiotherapist prevent and treat the person and meanwhile correct the biomechanics of the function of the athlete.
Friends, we have posted our today's feedback form, so kindly take a look of it. Is carbohydrate loading required during the high altitude training or competition?
Yes, carbohydrate loading along with the intake of fat also, because when you are having a good fat percentage, and if you want to go at high altitude at lower temperature, you have to take a carbohydrate and a fat rich diet also, I would say a good fat rich diet also, because when you go up, the fat act as an insulator. Okay, it won't allow to cold, yeah, the coolness, the cold temperature to get enter towards the core if the fatty layer is there. If I talk about the swimmers, if the ocean swimmers, I would say they can survive better in comparison to the person who is having a less fat percent. So you can take the carb loading along with the fat also.
So Dipti Jain is asking, some articles report training at high altitude result in increased level of cortisol in body, leading to early muscle breakdown. How do we combat that?
Look, when you train, I have already explained ki like 80% of VO2 max at the level of the C is equal to the 40%. Definitely, you want to exert a more and more effort in training to the high altitude and resulting in the release of more cortisol and resulting in the early muscle breakdown.
Is there any necessity of clothing with a particular kind of material for maintenance of temperature?
Yes, definitely. I have explained yesterday about to maintain the temperature, you should be wearing a woolen cloth with a multiple layer. And if you are walking out and the temperature is slightly increasing, you can remove the layers of the clothing.
Shantanu is asking, any kind of psychological support is required for player who are not experienced about nose bleeding before.
Any kind of psychological support is required for the player who are not experienced, and definitely if you are talking about a player, the psychological support always to be delivered to the player in any aspect, in any kind of injury, in any kind of performance preparation, in any kind of strategy. The mental and the psychological support have to be there with the player.
Lavi Saran is asking, is there any special medicine for the person having motion sickness, such as nausea during ascending plane or in car going to mountain?
Yes, there are many kind of medicines, but it should be prescribed as per the state of the body of the person, and depending upon the any present of any disease or a problem in that person. Only on that basis the person can take the medicine from a doctor.
Kumar is asking that after high altitude training, how many days it will affect?
Like previously in this PPT, I have mentioned like the 30-mile runners took the 30 days of acclimatization training. Then only they could get the three things only: minute ventilation, oxygen delivery, and the capillarization of the skeletal muscle.
Kaushik is asking, can you suggest high altitude training is better or sea level practice is good for the football players?
Look, I have already explained there is not that much difference in between the training of the two different altitudes, but you can even train the person at the sea level also with a better VO2 max percentage.
So regarding yesterday's session, there is a question from Charu. Uh, Training at gym, does tight clothing improves any change in the person's body?
And nothing like that to changes in the person's body, but there is some slightly concept is coming from the blood flow restriction therapy, blood flow restriction training. That's why the person want to wear the tight clothing just to implicate some percentage of the blood flow restriction.
Sir, I think we are done with the questions.
Okay.
Uh, Sir, there are few. So can we combine water with simple carbohydrate or sugars as high altitude activities? Will this have any effects on muscle activation or strength too?
Look, first of all, carbohydrate or sugar does not have any effect on muscle activation or strength. Second thing, you can combine the water with simple carbohydrates, but it should be vary in its glycemic index. Okay, if you will take a high glycemic index water, it will lead to the shoot up, like if I would say a term called rebound, like it will automatically shoot the insulin up and the performance goes down. So I will suggest to take the water along with the electrolytes when you are doing the activity at high altitude, and there is nothing effect on the muscle activation or strength, but it can increase the duration of your performance if it will be taken with a good strategy or in a good amount accordingly.
Kalol Ghosh is asking how a athlete can do this hypoxia training in sea level, as the hypoxia chamber is so costly. And uh, is there any setup in our country of this hypoxia chamber?
Like if you want to train in a hypobaric chamber at sea level, you have to require one. Okay, and if you are a sports person and want to do any sport at that level, then I think the association will provide the things to the player. And if you want to just do for the recreational purpose, then you have to afford that costly chamber.
So does India have any kind of, in our country, are there any hypoxia chambers are
Yes,
there?
sir. Our country is having the these chambers for training.
Can you let us know in which state or cities there are such kind of setups?
Sir, I don't know exactly, but right now a few sports organizations are coming forward with these kind of facilities.
Okay, yes, sir. Nilima, one of our viewers, she has shared about the detail. NIS Patiala is having one chamber. She has shared this information with us. There
Okay,
might
okay.
many also. So Charu is asking that what kind of exercises do you suggest priorly for a person who is going for high altitude for trekking, and how many days priorly they have to start exercising?
Sir, it again it depends on the what height of altitude they are going, and I would suggest to do 25 to 30 days of prior to do the training. And again, the same concept they should be applying to train a good VO2 max training at the sea level so that they can survive better at the high altitude. Mainly the aerobic training, I would suggest aerobic training.
Hmm. If any athlete practicing in the high altitude region but that athlete come to the sea level training, what type of physiological changes will be there?
Okay, like if the person is training at high altitude, there will be nothing that much changes to be present in the person. But if I talk about the improvement, that can be in the three aspect again, I'm telling the minute ventilation, the oxygen transport, and the capillarization, the skeletal muscles, and somewhat there will be the less exertion that a person can face during the exercise.
Sir, Dr. Nilima Deshpande, she is confirming that yes, we have at NIS Patiala, Sonipat, myself, a senior athletic coach at Patiala. They are having
Thanks,
this.
thanks a lot, Nilima ma'am.
Thank you, ma'am, for joining us, and thanks for sharing a valuable information with all the viewers. Thank you so much. So what is the difference between the rebound phenomenon and threshold level of lactic acids in muscle?
Like the threshold level of lactic acid in muscles is indicative for the fatigue in that person. Okay, like if the person starts exercising in its early phase, there is the threshold of lactic acid accumulation comes earlier. Just to delay that, you need to practice again and again for the aerobic training or whatever. I mean, the training what you are doing, aerobic or anaerobic, you have to keep in continuing. So whenever you do the training again and again, the adaptation of the body takes place, and the threshold level of lactic acid goes down and down. And I think that in starting the rebound phenomena occurs, like it can be a part of detraining.
Does living at higher altitudes, reduce COVID-19 infection risk?
I think not so. Living at the higher altitude does not reduce the COVID-19 infection risk because when you are at the high altitude, all the physiological system are suppressing, directly related to the suppressing of the immune system also. So I don't think so the infection risk is going down.
True. Sir, again, butterfly mark question is there. High altitude living people have butterfly mark on face. What is the reason, sir?
Sir, a butterfly mark on the face occurs on the white people mainly, and it can be due to the excessive oxygen hemoglobin delivery towards the skin. And our face are comprises of lot of capillaries, as I have already explained. During the acclimatization phase, there is increase in the capillarization of the skeletal muscles, and our face is having a first thing that the flushing will come. That's why the butterfly mark on the face comes.
Shonan is asking, is it true that removal of lactic acid in muscle is difficult at high altitude?
Yeah, sometimes, because I have already explained, there is alteration in the pH balance of the blood. That's why it's sometimes difficult.
How exercise physiology can affect in various body systems?
Exercise physiology is going to affect the body system in a positive way also. But if the body is exerting more aggressively in a different kind of atmosphere, different kind of temperature, different kind of altitude, then it's going to hamper negatively also. Okay, but let's not talk about the negative one, but the positive way the exercise physiology can improve each and every aspect of our physiological system of our body. Say for example, like if you are doing aerobic training, it's gonna increase the aerobic mitochondrial activity, aerobic enzymes. It can also increase the delivery of the much oxygen to the each and every system of our body, resulting in the better function of the physiological systems of our body. It will give a better impact on every situation of our body.
The vegetarian diet has effect on performance of an individual at high altitudes.
It depends. It depends person to person. What because I'm saying these things to become in the upcoming things. Like suppose a person is not having a much red muscle fibers. Suppose, and if the person is taking only vegan diet, so there are less chances to overcome the red muscle fibers. If the person is have the requirement in its sports field or sports aspect, then it can happen.
Kumar Selvam is asking the Ethiopia and other peoples are they live in higher altitude and competition in sea level, but we are in we live at the sea level and practice in high altitude. Then how can we compete to them?
Look, if the competition is in their place, so you have to prepare yourself at sea level, either in the hypobaric chambers, okay, or you have to train yourself at very peak in your aerobic capacity. Then only you can going to compete there. But if you are saying like the those people are also coming at the sea level, you are also the sea level, so don't worry about the performance. There is not much difference in the physiological system of the body of theirs and yours. Nothing matters in the altitude.
True. So that is one very good compliment I would like to show to the viewers. Thank you so much, physical education activist. It's really nice to come on this platform and get to know new things from your program. Thank you so much. It definitely increases our morale and our enthusiasm to keep organizing good things for our colleagues. Thank you so much for the feedback. How does inhalation of camphor helps to breathe normally at higher altitudes?
How does inhalation of camphor related to? Okay, I think the if it is happening, if the camphor is doing these things, I think this is going producing the dilation of the upper respiratory tract. Then only the person can breathe normally. So that's all. The camphor can do the dilation of the upper respiratory tract.
High altitude training, what is the effect of our heart and endocrine system?
For the heart, I have already explained there is increase in the submaximal cardiac output, submaximal contraction, and sometimes increase lowers the stroke volume. And if I talk about the endocrine system, it will also like somewhat if you're going much and much up, it can also going to suppress the endocrine system because at high altitude the depressive effect on our body is coming, and if you're staying for a prolonged duration, it can also hamper things.
Yes, sir. The last question, how vegetarian diet affects the performance of an individual at high altitudes?
I think it has been
You
done.
covered it. Yeah. So, okay. Let me check once more. I think so. We are done with most of the questions. If I have missed any, then I'm extremely sorry, viewers. I tried my level best to find most of the questions asked by you. And thank you so much for joining us. It was really wonderful interactive session, and we literally enjoyed it very well. Thank you, Dr. Sir. Thanks for being with us, and your knowledge is quite extraordinary. And the way
Thank you so much, sir.
That way actually appeals most of our viewers, and they all are praising you, the way you are explaining the subject and making it simplified. It's quite valuable. Thank you so much to the viewers who are viewing live with us, and those who will view afterwards also, because our video very quickly reaches to more than 1,000 views in before 24 hours. Most of the videos are trending like that. So thank you so much, viewers, for joining us. We are very happy for this. And thank you, Dr. Jatin sir, once again. Yeah, Janvi, please.
Thank you so much.
Now, I would like to thank formally to Dr. Jatin Maheshwari. I would like to thank Dr. Jatin Maheshwari for sharing very good information about applied exercise physiology in different weather and conditions. It was a pleasure to have you with us on this platform. This session has cleared many misconceptions about selection of training methods, selection of exercises, effect of exercises in different weather and conditions. You have covered very minor but very useful details about precautions and treatments during different training programs. Thank you, Dr. Jatin, again to share very valuable insights about regarding this topic. I would like to, say special thanks to Dr. Neeraj to invite you for this FTP program. And it is my pleasure, and I'm feeling so great to have contacts like you, Dr. Jatin.
Thank you so much, ma'am. I would just like
but
to
not the least, all the participants.
just extend my thanks to
Please.
Dr. NIRAJBHANSALI sir and Dr. Janvi ma'am, Spinex Global or University, and it will really my pleasure to be on this platform with the huge viewers. And, I mean, commendable, sir. Thanks a lot, sir. Thanks a lot, ma'am. Thank you.
Thank you very much, sir. And I especially thank to Dr. Jatin and Dr. Vikas. Actually, Dr. Vikas introduced me with Dr. Jatin, and he managed that he made it a point to have you on this platform. So thank you, Dr. Vikas, for that. And your recommendation and your trust on Dr. Jatin is absolutely true. And he is definitely a gem of our country. Wonderful. He's having. Thank you so much, sir, for being with us, and thank you, Oro University, for organizing this wonderful event with Spinex Global. We are very happy. Thank you, Shanvi, for being with us throughout and helping us out to organize the wonderful event. Thank you so much once again. Thank you.
So, last information.
Yeah.
Hello.
Yes,
hello. Yeah, so last information about participants, that few participants are facing problem to comment in the chat box of YouTube. If you can't comment in the YouTube chat box, you have to take a screenshot from your mobile and share with us. We will try to accommodate your request, and look forward to see you again tomorrow at 7 p.m. Yeah, thank you. Good night.
Yeah, actually, I would like to let viewers know about this. There is a filter on the YouTube chat we have put, so that filter might not be filtering certain chats. It might be feeling that this is not worth posting. So don't worry about that, because it is auto-generated filter. So you can click a screenshot on your mobile and you can share it in the feedback form. That is absolutely valid. Like it is appearing in the chat also. So don't worry about that.
Great.
Yeah. Okay.
Thank you
very much.
Sharing this.
Thank you so much. Thank you.
Good evening, everyone. Thank you so much.
Good evening.